The aim of the interprofessional team immersion was to provide University of New England students with the opportunity to gain a better understanding of the roles and responsibilities of each healthcare profession and have a chance to practice communication skills in a telehealth setting. The current group included students from occupational therapy, physical therapy, social work, osteopathic medicine, allopathic medicine, dental hygiene, and nursing programs. Our research questions were: how do interprofessional relationships affect teamwork and resilience? And does additional time for social connections have implications on teamwork in the healthcare field?
Group faced many limitations while working together, one of which was difficulty building trust and rapport with our client through telehealth as it lacks personality. Another one was the lack of time we had for building interprofessional relationships within our team. And we also had decreased exposure to other student health program demands throughout our curriculums. Some of the strengths that our group found were that we took additional time to meet as a group outside of what IPD had provided us with. We had mutual respect and understanding of each other's professional roles, and we all came prepared with our own ideas and plans before meeting to be able to contribute to the group.
It's a unique experience within IPD to receive feedback from the patient actors at the end of both patient encounters. Our team experienced some significant challenges with the way we receive feedback from our patient actors, and this is why we've led to the research question of how do interprofessional relationships affect teamwork. The additional time that we spent really helped buffer our resilience in the way we receive feedback to make sure that we could interpret that in a way that was productive for each other and ourselves as a team and our own future implications as healthcare workers.
We apply this to our future practice. Together, we learned that spending more time communicating and elaborating with our team unit allowed us to gain a more clear understanding of the interventions each profession can provide. Working together to collaborate as a team unit on patient care plans allowed us to help gain an understanding as each other as a resource as well as a referral network.
We want to thank the University of New England and Rosalind Franklin University for coming together to make this immersion possible. Through IPD, students are able to make professional contacts outside of their own health profession. They're able to gain comfort in identifying, acknowledging, and taking steps to prevent and correct medical error. And we're all able to practice our interpersonal and interprofessional communication skills for diverse and difficult healthcare conversations. Really, what this allows us to do too is take all of our awareness for how interprofessional teams come together and practice it on a clinical practice level.
Thank you very much.
Well, thank you. So this is we have a few minutes for Q&A, and I expected Provost Shelton to raise his hand. Go ahead.
I always ask a question. So this is to the entire group. Tell me one thing that you were surprised about learning, something you learned about what another profession does.
I was kind of surprised at how many resources like Sarah knew about. She's in social work, and like I didn't realize how I honestly had not much of an understanding of what a social worker does. And after like doing this group experience, there's so much like it's like turning through my head, and I'm like, okay, if a patient's struggling with this, I can get them in contact with the social worker and she can help them with X, Y, and Z. And like there was like that was a huge bridge that I feel like is going to help me in the future.
Amanda, what profession are you?
I'm in dental hygiene.
Well, fantastic, great learning. And Sarah, how do you feel about Amanda's learning?
I'm so glad Amanda jumped right off first, because I actually was going to say that I was so impressed that Amanda in dental knew so much about the patient's medications. She had done advanced research to really understand the pharmacological product, and I really would have thought that would have come from pharmacy. We didn't have a pharmacy student on our team, and that was really filled by dental. It really blew my mind how much awareness she was able to have.
Fantastic. Another question. Courtney, did you want to say something?
Sure. I'm from physical therapy, and I thought it was just unique going through the whole process, just learning about how kind of all of our professions interlap with one another, where someone might provide medication and someone might recommend exercise and someone might recommend just social work. So it kind of like was really neat to
fill in the gaps for everyone else of where their profession kind of ended and where one started. So that was really unique that we could all kind of work together.
Courtney, I should have shared, the majority of my career here has been in the Department of PT. I was a program director for over 20 years.
Nice. Great. Who would like to ask another question or make a comment?
I have a comment. I was looking at the takeaways and I really liked how it said to be intentional with your suggestions, because I feel like through school you just learn so much, and then when you're new in the practice you just want to help, and I feel like a lot of times it might be overwhelming for the patient to like give so many different suggestions even though you have good intentions. So I feel like I really enjoyed that takeaway of just kind of really thinking about like how much information you want to give and how helpful it would be to kind of make that more concise and like more client-centered.
I wanted to comment about team resilience. I think that that is a critical takeaway, and I'm so glad you presented on that, because sometimes working with patients is difficult. And especially when dealing with something like long COVID, which we don't really know very much about. I think patients are frustrated and practitioners are frustrated. How did you come up with the idea to focus on team resilience, which I think is very forward thinking?
I can hop in and say that I think we wanted to develop relationships with each other, and telehealth has been really challenging with that. I think that some of us discussed that our expectations we would have time to get to know each other going into this experience. And one of the things we were hopeful for about the IPD experience was that we would have more informal time. And when that wasn't really presented, we created it. We joined a Zoom ahead of time for an hour and called it pre-IPD team mingle. So we could just get together and chat about what was going on with our lives and our programs and our learning. We discussed a little bit of the case, but I think those relationships, what we learned was they were really significant. Especially we got some difficult feedback from our actors and in a way that really didn't sit well. And because we had invested in building relationships and trust with each other in that informal get to know you time, we were able to reconnect and kind of process that together and do a team processing. And I think that would really help us face adversity, just having relationships with our colleagues interprofessionally.
Thank you for that, Sarah. That was great, because relationships really matter, and the idea of psychological safety and feeling comfortable with one another is critically important in the workspace. And we heard that a lot in our research that we did, is that ability to form relationships and trust one another was critically important. I'll ask one more question. If probably Mike and I can continue asking a lot of questions, but you've mentioned the difficulties of telehealth, and I'm curious if anybody would like to comment on that. The impression I got is that it's a little awkward, it's a little impersonal. But you can say more, and how did you navigate that?
I can jump in on that question. I think one of our conclusions at the end of this project was that next time we would send in an initial patient navigator, likely either the social worker, which would be Sarah, or me as the occupational therapist, just to kind of build that rapport and trust with the client, because it is a little bit more difficult to do over telehealth. So that's one of our biggest takeaways for the future.
Great, thank you. Other comments?
Just to clarify, Megan, are you suggesting like a hybrid model where there'd be some initial contact, but there could be follow-up sort of via the telehealth option?
Yeah, that, and also just always having that navigator in the room, either over Zoom, or I guess it could be with the client as well when they're interacting with other healthcare professionals. So they already have that trusting relationship with one person.
To build off what Megan said, our patient expressed that she was overwhelmed when we had new health professionals enter the room. She didn't see a familiar face from the first session, and she did express to us that she was like overwhelmed. She was like, who are all these new people? So that's why we thought it would be helpful to keep one person there constantly with other people rotating in and out.
Thank you so much to this group. And I just wanted to keep everyone on track in terms of timing. So I'm just going to be sharing the next screen.
Awesome. All right. Well, welcome everyone to our poster presentation today. I know the team is really excited to kind of dive into our experience and share a little bit about it with you. So our team consisted of a wide variety of professions. So I'm just going to introduce ourselves real quick. So Cassandra Pierce of the School of Social Work, myself, Morgan Voigt of Nutrition, Madison Champagne, who's a physician assistant student, Alexandra Fiera, Physical Therapy, and Tess Seibert, Allopathic Medicine. And she attends Rosalind Franklin. So, all right, yeah, our topic, we talked about how word choice affects the relationship building process with patients and clients. So really talked about how to build that rapport and the importance of word choice in that process. So some of our key takeaways, we focused heavily on motivational interviewing. We found that this was a huge part of our experience with Amanda. So the fact that motivational interviewing is a great tool, especially when the patient is apprehensive about sharing information. Amanda was very hesitant coming in about having a new care team. She had been through a lot, and having a whole new care team was really scary for her. So using those motivational interviewing techniques were huge. Further, our tone, body language was also really important, and something that we realized we really had to be mindful of during the appointment with her to make sure that we were presenting ourselves as open and ready to have that conversation. In addition, the importance of avoiding activating words. So really activating word for Amanda during our appointment was choice. So that's kind of, we can dive into that later, but what inspired this poster. The art of mirroring your patient. Cassandra, who's our social work student, did a wonderful job at this, really mirroring how our patient was feeling and making her feel comfortable in the setting. And also allowing time to pause and to reflect, especially during our simulation, things did get emotional, it did get heated. So again, putting that pause in there and really allowing time for people to reflect was super huge. So those are just some really fast key takeaways that we got from our experience. Overall, it was an absolutely fantastic experience. I had a great time working with such a great group of people in a variety of professions. Everybody brought a wonderful perspective to the table. So overall, it was wonderful.
Well, we have tons of questions here, at least in my brain, but I'm going to ask you first to see who has questions for this team. And I think language is so important, even more important in these current times. But who else would like to ask a question?
I'll ask a question. Hi, my name's Kirsten. I'm in social work as well, and I'd love to know more about what you alluded to in your presentation about what was activating about the word choice. I'd love to hear sort of how that came about.
I can answer that. So during our interview, I asked what had led our patient to make the choice to go to the hospital. And her return answer for that was that it was not her choice, that she has had no choice in any of the process that has happened since she had COVID, and that as a Black woman, she doesn't often have choice in the healthcare field. And that particular conversation led to a very emotional state for her.
Anyone else on the team want to reflect on the word of choice and how it activated? And Cassie, you just added an element that you were dealing with cross-racial patient practitioner relationship, and that the issue of choice does become a volatile issue often when we're dealing with race and discrimination. But I'd be really interested to hear if anyone else on the team wants to comment on that before we move to another question.
I can. Another word that we used during our encounter was, we said try. So the patient kind of felt that we were experimenting when we were like, oh, well, we could try this as a solution, or we can try this medication that should help. And she's like, what do you mean try? Like, why are we experimenting on me? And so that just was another example of how you being very particular about the words you use and how you speak to the patient, and especially with the whole scenario, just making sure that you're taking each patient as an individual experience and making sure you're getting the whole picture and being very particular with your word choice. That's something like that was our biggest takeaway from this experience.
Thank you, Madison. Anyone else?
Yeah, I'd like to add to that. So when our patient became activated, when the word choice was used, Cassandra used a really cool tool to kind of de-escalate the situation. And it was as simple as just taking a moment to pause and just allow your brain to kind of reflect on what's going on and to breathe and calm yourself down. And I was amazed by how well that worked. And I think all of our teammates were like shocked at, the effectiveness of it.
So it sounds like you learned a lot from each other in a very difficult situation. And, it occurs to me that with another client, the term choice or the term try might not be activating. And so you do the best you can in the situation that you're in. And it sounds like that's exactly what this team did. Any other questions?
I'm just not gonna ask a question. It's just a comment, and it is how every day we learn from our patients.
I think that our patients are our teachers and that we learn from every patient experience. Thank you, Dr. Arafat, for that. Do you feel that way? Does the team that did this, is that something you got from this, is learning from your patients? Yeah, they're a member of the team as well. Thank you. Julie, do we have time for another question, or are we moving on?
We are moving on. I was just going to say thank you so much for this group, and I'm gonna, we have a transition for 1 minute.
Hello, we are the Empathetic Earthlings, and our poster is called Promoting Optimism, an Interprofessional Approach to Treating Long COVID-19 via Telehealth. The purpose of our poster is to showcase how we approached a case of chronic illness using a collaborative approach in order to positively address the needs of our patient. Our patient was a 39-year-old female suffering from a case of long COVID, and she had difficulty accessing resources to help her get treated. So our team took a collaborative approach to help her obtain the resources and help that she needed.
The team wanted to know as much as possible about Amanda as a person. We wanted to know about her interests and her strengths, her family life, her job and financial situation, as well as what gave her life meaning. The discussion of these topics helped not only the team, but Amanda realize how much she'd been missing in her life, in her journey with long COVID. And this prompted us to focus on ways to offer empathy to her and also suggestions for optimistic ways that she could manage her journey as she goes forward through this process.
After investigating the extent of and context surrounding Amanda's health issues, the team suggested diet adjustments, new medications, and various maneuvers to help with pain management. While answering questions regarding the side effects of medication proved challenging in real time, the optimism generated by the easy-to-do maneuvers recommended by our physical therapist more than overcame the mishap. The immediate impact the maneuvers had on Amanda's pain dramatically shifted her disposition from a state of despair to one of hope.
Table 1 contains considerations from each individual specialty, and as far as benefits of working on an interprofessional team, firstly, we each have expertise in different areas, so working together allowed us to expand our pool of knowledge. Second, collaboration as a team allowed us to give and receive feedback prior to presenting ideas to the patient, And third, because we were able to work together in real time, this promoted efficiency in communication and therefore patient care.
So after receiving feedback from Amanda, there were a couple of things that we could have improved upon, and we had a couple future considerations. So these included having everyone on screen introduce themselves before starting their patient interaction, summarizing our plan of care and being clear with what we wanted to accomplish in each session, and also giving Amanda tangible and specific advice for things that she can work on herself. That would help her to empower her and reach her goals.
In terms of takeaways, throughout this experience, our team agreed that we were grateful to have the opportunity to collaborate and better understand each other's scope of practice while finding common ground through supplying empathy and validation during our time with Amanda. We found that providing the right amount of support and empathetic validation in combination with simple and easy integrated interventions were most helpful to Amanda. Lastly, we want to thank everyone who made this opportunity possible.
That was inspiring. Thank you so much for that presentation. So I'm going to open the floor again to some questions or comments. And I love the focus on positivity and how you create positivity at times of deep uncertainty and just the context of the times. So who would like to ask a question or make a comment? Kelly.
So I'm curious about the things that you learned that you'll take out into the world with you. What was most important about this experience that you think will really translate well into your practice, and things that you will remember when you move on into your professional life?
I can take that first. Hands down, it actually, the title of our poster encapsulates what I will take forward from this experience, and that's promoting optimism. Some of the feedback we received from our actresses, which both of them in real life, it turns out, suffer from chronic illnesses. So the feedback was truly meaningful. And the patient, Amanda, asked me at the end of one of the encounters or during some feedback why I asked so many sad questions, and I'm a social worker. So that's a kind of a gut-wrenching thing to hear, but it really definitely my takeaway from that is to, she indicated that I had left her kind of thinking about some sad things in between encounters and then kind of walked away. And so that was incredibly impactful for me. So I hope to never do that again, and always try to, do something similar to what Emily Howe did. She kind of swept in PT and just gave Amanda this amazing physical therapy. It seemed like a very simple thing that the patient could do on her own with limited instruction, and left her feeling with a sense of, oh my gosh, there is some hope. And so I think that's my takeaway.
Other team member, oh, go ahead, Jen.
Hi, everybody. What a great presentation. It was really exciting to watch. Sort of building on Kelly's question, and I think my question is for you all, but mostly for you, Hannah, as a rising physician. Very curious to hear how this experience impacted your thoughts and beliefs and future practices on leadership. Is that am I unclear? I'm curious how this may have impacted your ideas of how a team works and how leadership is involved as a part of a role. It's a little not exactly a relationship, but more of a role question.
Jen, can we open that up to the whole team?
Absolutely.
Yeah. So really the question is about how the experience impacted your sense or empowered you to think about your own leadership and your role as a leader on the team.
Well said. Thank you for that help there, Shelley.
Hi guys, so I am the physical therapy student, but to kind of go off of that question, I think being able to advocate for your own profession, especially when working with others who might not have like a really good sense of what it is or what you do, is a big part of that. And being a leader within your own profession to be able to advocate and like
say what you do and what you can offer is a really big part of that. And I definitely learned that in this experience.
Yeah, and to build off what Emily said, I'm a first year medical student at the Chicago Medical School, and I completely agree with what Emily said. I think as a future physician, I think it's really important to really create the space for these other professions to really talk about their experience and their expertise, because it's so valuable. And I'm so incredibly glad that I had this experience so early on in my training, because I get to learn about these other professions and what they can offer. And it's ultimately, the amazing work laid by Kirsten, our social worker, creating that foundation of trust, and, simple movements with Emily Howe and, our PT student and our OT student that really led to that sense of self-efficacy for our patient. And that's ultimately what we all hope to do, like leave our patients with a sense that this can get better. And that's what I'm so grateful about this experience.
Well, I think unfortunately we have to move on, right, Julie? We could talk about this for quite a while. Thank you all for this. And now we're going to the fourth presentation.
Hi, everyone. Thank you so much for being here. My team and I are going to be presenting on an interprofessional care approach to long COVID treatment. To start, what is long COVID? Since the beginning of the COVID-19 pandemic, many patients have been struggling with ongoing physical and mental symptoms that persist long after their original diagnosis. So Kendra is going to talk to us a little bit about who Amanda, our patient, is and some of those symptoms that she's been struggling with for a while.
Amanda is a 39-year-old woman who was hospitalized after being diagnosed with COVID-19. Amanda has been experiencing severe migraines, fatigue, and other symptoms relative to long COVID. In order to provide the best care for Amanda, we, as an interprofessional care team, asked her what her most relevant fears and concerns were at present time. Amanda stated, "I want to feel more like myself. I want energy, to breathe like a normal person, to not be tired and not have migraines. I want to feel like my old self." Amanda also felt depressed for her children and husband, Mo, because she wasn't being the mother or wife that she used to be.
While treating patients in interdisciplinary teams requires an additional layer of coordination, there are many benefits from a provider point of view. Chief among them is real-time collaboration and communication, time efficiency, and reduction of miscommunication. There's also a greater sense of shared ownership and collective responsibility of the patient's well-being. One of the largest benefits of working in interdisciplinary teams is that we can take a divide and conquer approach and provide focused attention to specific issues that the patient is dealing with. For example, during our second patient encounter, while one member focused on medication changes, another member focused on virtual and in-person support groups, and yet another focused on counseling our patient regarding nutrition and dietary changes.
In addition to the benefits provided to the team, there are also benefits from the patient perspective. Our guiding principle was to address the patient's physical, mental, and social needs. This provided clarity to our agenda for each meeting and in the creation of the treatment plan. The interdisciplinary approach also makes efficient use of the patient's time and energy. Amanda did not have to repeat her symptoms and concerns to each team member. Instead, she was able to communicate this information once. Lastly, Amanda arrived to us discouraged by her symptoms and lack of improvement. She met with a diverse team ready to work together to help her make progress. By the end of our last meeting, she felt supported and hopeful for positive change.
The team provided Amanda with access to support groups in her area, as well as groups on social media that she could connect with to feel supported and believed. They also provided Amanda with a self-care worksheet to fill out with each of her children in order to discover quiet activities they could do together to connect and keep Amanda from experiencing migraines. The goal with this sheet was to involve her children in the process to keep Amanda physically and psychologically safe while interacting with them, and for the family to assume agency over their daily lives at a time in which so much felt out of control. Additionally, the team provided financial resources because both Amoa and Amanda felt that they were in need of financial assistance given lost work as well as extremely high hospital bills.
Even though there isn't a lot of information on COVID-19 or the long-term effects, we learned a lot as a group. We learned about each other's professions, how to work together, and how COVID will affect individuals in the long run. We also learned collaboration, communication, and problem solving.
all while keeping the patient in mind. Having the opportunity to discuss patients as a team and get different perspectives from other professions allowed us to create the best treatment plan for the patient.
We would like to thank our facilitators, Dana Lawham and Albert Abina, for their guidance and encouragement throughout this experience. Additionally, we would like to thank Chris Hall and the CECE team for organizing this interprofessional learning opportunity. Thank you for listening, and we are happy to answer any questions.
Okay, it's time to be happy to answer any questions. Who would like to start? Well, I'd like you to talk about shared ownership. You used that terminology, which I thought was really powerful, because often individual professions feel responsible and that they carry the burden. That's the language we've heard quite a bit. So can one of you or a number of you speak to that issue of shared ownership?
I can start us. I think we had pretty frank conversations right at the beginning to sort of state where we were each coming from. We all had pretty common concern for Amanda's mental health in addition to her physical well-being. And so there was this sort of immediate, like, okay, we're all here for the same reasons. And then we were able to find sort of which professions complemented each other well. And I think that really helped in terms of sharing the burden and also being comfortable saying, like, I've got these things, can you sort of take this? So from a social work perspective, I found myself sort of aligning with OT a lot. And I know like our physician and PA bounced off each other a lot. So there were just ways to say, like, we have a lot of common ground here. So how can we do this without bumping up against each other or doing double work?
Thank you. Other members of the team, would you like to build off Katie's point?
Just to build off of what Katie said, I think something that we did before we ended each meeting, we were clear about who was covering what. So expectations were clear leaving each meeting. And then we knew exactly what we needed to work on before our next meeting. So I think that not only kept us on track, but it also really did feel like the burden of research and looking into different resources and such was really shared because we made a plan before each meeting ended, which I think is helpful.
Nice. Really nice.
I think also to add to what Kelly just said and to really enhance what they said, for us, we all knew that time was of the essence and that for us, process and agenda was really key. And so Mary was really great in helping us all focus on coming up with, 3 different priorities. Like no matter what, based on the patient's set priorities, we're going to address it from a physical, mental, and social point of view. And we're definitely going to do that and have that be our goals by the end of the meeting. And so I think that really focused us and made us all invested in that process. It's something we agreed to. It works really well. And I'm thankful that we all, had that experience for sure.
Mm-hmm. Thank you. Another question or comment for this team?
From an OT's perspective, I kind of loved how you guys provided that self-care worksheet for her and her kids so that she could still continue doing things that are really important to her, but not kind of add on more stress to, all the other symptoms that she was going on.
Yeah, I feel like we had a lot of ideas between all of us on what we could work on for this patient to, in our view, improve how she's doing. But I think, like kind of what Swati was saying, what really focused us was we put it to the patient. What's important to you? What are your priorities? What is your right now needs to get done? And that's, I think, what partially led Katie to go down that road with her.
I know we have to wrap up, but I do want to say how impressed I am with the fact that you did a very intentional planning. That was something that it sounds like you did with care and you did with foresight. And even though working with patients is completely unpredictable at times, the fact that you did that was very impressive. So I don't know whether you want to say something about that, because I know Julie's going to shuffle us off to the final presentation, but good work, really good work.
Welcome to our IPTI poster presentation. Our title of our slide is The Power of Interprofessional Collaboration in Building Rapport, Addressing Long-Term COVID through Telehealth. Our professional team consisted of students in various healthcare fields, including allopathic medicine, osteopathic medicine, physical therapy, occupational therapy, social work, and pharmacy. This poster is to show us how we use telehealth and motivational interviewing to treat our patient with long-term COVID.
With the prevalence of the COVID-19 pandemic and the movement of most of telehealth, we wanted to ensure a safe and comfortable environment for our simulated patient, Amanda, to discuss her experiences with her COVID.
So the primary goal of motivational interviewing was to understand the most important, most impactful symptoms that our client was experiencing. And from that, we figured out that the migraines that she was experiencing and sensitivity to light and sound were having the most negative impact on her life overall.
Our team also focused on building rapport with Amanda. It was clear from our first meetings with her that her symptoms were causing her distress. So we focused on validating her feelings and showing her empathy throughout. And this was especially important because all of our interactions were via telehealth.
And through building the strong rapport, she was able to trust our recommendations, like a medication change. She has high blood pressure, a cough, and migraines. So we decided to switch her from lisinopril, which can cause a dry cough, and change her to propranolol, which could treat all of her symptoms and not adding additional medications on top of everything.
We really focused on simple solutions that Amanda could see fast results with. She was an employee at Home Depot, and we came up with finding different light bulbs to limit the brightness in her house, as well as using earplugs. And kind of going forward, we think future considerations, especially for rural medicine, can keep that in mind. So finding non-pharmacologic, homeopathic, simple solutions to treating patients with long COVID symptoms.
I just have to say how struck I am with how different each of these presentations are, and what a different focus there is on each one. So questions or comments for this wonderful team? I know someone has questions besides me.
I'll jump in with a question for you, Shelley. So I put it in the chat as well, but I'm just curious, in those moments where some role blend happens, how your team specifically might have navigated that reality.
I can kind of talk a little bit. We didn't do any kind of like pre-meeting mingling or anything, but our team, I think it was just because we were all so patient focused that we all kind of just got along super well immediately, which was really great for kind of taking that into building rapport with Amanda. I think one of the big things that we did was we would just kind of be like, okay, I'll do this, you do that. And we just kind of gave each other responsibilities. And then in each interaction with Amanda, we also, I think the first team today spoke about this a little bit, but Amanda was overwhelmed, of course, in all of our interactions, especially with seeing somebody that she hadn't seen before on our team. But we started each interaction with saying, I know you spoke with Billy, who was our occupational therapist student last time, and just kind of started each interaction with a follow-up from what our team members told us the time before. And that was huge in creating rapport with her and kind of showing her that we have good communication within the team. So we kind of saw her trust us better. And even though she didn't see me, which she saw the first time, another team member kind of talked about what I had taken from our interaction.
Yeah, and to echo what Molly was saying, I really didn't know what to expect going into this experience in terms of how our team would work together. And like Molly said, I felt like from the beginning we were all extremely patient focused, and I feel like that helped us really center our strengths as a team. And it was always about what would be best for the patient. So if we knew, for example, Billy has a lot of experience with motivational interviewing, we would talk through what he would do. And then if someone else had more experience talking through medications, we'd base our interactions that way so that we were really highlighting our strengths and meeting her needs.
How other questions or comments? I think for me, I loved the concept of giving short-term solutions to some of her issues. That felt like a way of really honoring her situation, that she was really in distress. But also I think it was very clever to think about what can we do for her in the moment that would give her some relief, that would boost her optimism in a sense. Can you talk a little bit about how you came up with that as a team, and how you utilized it?
Yeah, I can speak a little bit to that. So through the motivational interviewing, we realized that these migraine symptoms were causing a lot of emotional distress, which was playing out in her family life in a really huge way. So my thought process was kind of just to, if we can get in the way of these physical symptoms as efficiently and as quick as possible, we can start to counteract the emotional fatigue that she's experiencing, that the rest of her family is experiencing. And if that emotional fatigue can lessen, and she can start to feel better emotionally, and her family can start to feel more supportive, then maybe the longer term effects of the different medication could have time to catch up and do that. And she can also use these simple interventions at any time. Sunglasses inside might look a little weird, but it's very effective at reducing brightness and reducing those migraine symptoms caused by light. Wearing headphones inside also might look a little weird, but she can do it at any time. It's a very simple thing that can bring about some pretty instantaneous relief. So yeah, it was just starting at the bottom and working our way up from there, I guess.
Nice, thank you. Other members of the team, was there any resistance to that, or did everybody, because you said you didn't plan, but you just had this nice synergy. Was there any other thoughts, Devin?
Yeah, I would say there definitely wasn't resistance. I think we were all very thankful that Billy kind of had those ideas and offered them in the moment, because as we said, our standardized patient was pretty distressed throughout our interactions because of her physical symptoms. And it was also really powerful because Billy, like you said, used kind of the information he'd gathered about how it was impacting her life, but also the fact that her and her husband, in our case, worked at Home Depot. And so the suggestions that he was making about potentially buying different light bulbs or different things like that, that they could actually get where they work, was even more actionable for them. And they both felt way more empowered after those suggestions.
Well, really nice work, everybody. I know I'm supposed to remind you to do the attendance sheet. And more than anything, though, I want to thank you for your fantastic work. And there's no coming together afterwards. So once you do your attendance sheet, you may do whatever else is part of your day. And thank you so much for your participation.